we'll have a session for questions. We are going to test some of our colleagues here to see how the product works. And then after our discussion, I think we shall have our dinner. Then we can go home. But we shall see how we shall consult ourselves after this. Maybe we might have something else in the future if you get interested. Thank you so much. Let me invite Mr. Hugo at least to start, and then we don't spend a lot of time. Thank you so much. You're welcome.
Fantastic, Jackson, and thank you for arranging this together with Dr. John. It's an honor for me to get your attention to talk about something that I find extremely interesting, and that is also a big health challenge for a lot of people, because it's not really the way it was supposed to be from Mother Earth in the beginning. So let me share the screen with you. Jackson, can you let me know when you can see the screen?
Yes, we can see you. Fantastic.
Then again, like Jackson and Dr. John said there, my name is Hugo Olsen. I am a Norwegian. I was born actually up very far up north in Norway, Tromsø, north of the polar circle. So that's an area where you have the midnight sun as well as the day sun, everything in the summer and then nothing in the winter. I was born in 1963, and I guess that means I have to work with the balance, the omega-6, omega-3 ratio. I'm married with a beautiful woman from the Philippines. And like Jackson said, I have been working for 25 years with medical technical equipment, helping aids for healthcare, hospitals and nursing homes. I've been to South Africa many times, and now I'm really looking forward, and I so wish I was there physically with you in Tanzania. But as soon as this COVID-19 crisis and all these things is behind us, then I will indeed love to come and visit you and do the presentation live instead. So Zinzino, the company that I'm partnering with, that I'm working with, and I've done that back since summer 2010. It's a worldwide growing company, headquarters in Sweden, and you can see here that we had last year a turnover $115 million US. We have opened up around 100 markets where we can have customers around the globe, and also colleagues that will help spreading this good news. We have around 300 employees at the headquarters, and we have our own R&D and manufacturing, which means that from ID to finished product, it goes very fast, and I will tell you more about that. So it is like this. We all want to feel good, we want to stay fit, and we want to be healthy. But unfortunately, the lifestyle diseases, the diseases of modern lifestyle, so to speak, and particularly this one that I will talk more in depth about, cardiovascular diseases, are killing a lot of people globally. Actually, last year, around 20 million people lost their lives with only cardiovascular diseases. And if we add all of these diseases that we call the metabolic syndrome, you can add up to around 40 million people globally. So we want to feel healthy, but the problems are increasing, and it's time to ask why. And I would say that one of the major reasons is that we are not really listening to the modern father of modern medicine, Hippocrates, from the Greek island of Kos, that 2,400 years ago said, "Let thy food be your medicine, and let your medicine be thy food." And these are words that he has been extremely famous for. But unfortunately, we have changed a lot away from the way he taught us, because we used to be eating food from Mother Nature, full of vitamins, minerals, phyto and micronutrients, beta-glucans, fibers, healthy fats, and these essential fatty acids that we call omega-6 and omega-3, we had that in a good balance. But today, we actually eat more and more food that are man-made, processed, semi-processed, or even ultra-processed foods, which means that we have a much lower density of the nutrition levels in the food. It's very high in sugars and refined carbohydrates. In other words, we are from a calorie point of view, we are overwhelmed. We get too much, but from a nutritional point of view, we get far too little. Actually, people talk about people today being overweight and, you know, type B malnutrition because we lack too much fibers, we lack vitamins, minerals, we lack these essential fatty acids, and we have ended up with a very big imbalance between these two omega-6 and omega-3s. And you can put it this way: historically, our DNA is programmed to have a balance of 1 part omega-6 to 1 part omega-3s. Science is actually recommending that we should be 3 to 1 or lower. And it was actually the decade when I was born, back in the 1960s, where the big turning point started. We were in average on the 60s, we were on 4 to 1. The European average is today 15 times more omega-6 than omega-3. And if we look to United States of America, it's actually 25 times more omega-6 than omega-3. And then we can ask, okay, what are the consequences? Well, we can read that in this book of Dr. Paul Clayton. Dr. Paul Clayton is a fellow at the University of Oxford in United Kingdom. He has been researching food, botanic ingredients, phytonutrients, how the brain is working and our behavior for over 45 years. And he has written this book here called Out of the Fire. And that book is all about why chronic inflammation is the root of all diseases and how to put out the flames. And the fantastic thing that I can read, or we can read in this book, is that our bodies have a fantastic mechanism for self-healing, provided we take away the things that put us on fire and add the things that are closing the fire, getting a healthy lifestyle. Dr. Paul Clayton in his book here is giving a quotation from Scientific American, where he says that inflammation is an underlying contributor to virtually every chronic disease like rheumatoid arthritis, Crohn's disease, ulcerative colitis, diabetes and depression, along with the major killers such as heart disease and stroke, and of course, cancer on that list as well. And the reason why it is so important to be in balance is because it affects every single one of our cells. And we are all built up of around 100 billion cells. And you all there know the cells, so I apologize if I say things that are very obvious to you, but as a cell, the nucleus in the cell, we have the mitochondria that are the small energy factories within the cell. Then, of course, we have a lot of other things inside the cell, and all of this is nicely wrapped in a cell membrane. And this cell membrane has an inner and an outer layer. And what we find in between here, building up the structure of the cell membrane, is what we call a phospholipid bilayer. Actually, the majority there is fatty acids. And you can find saturated fats, monounsaturated fats, and polyunsaturated fats. But there are two that needs to come in through our diet and that are essential, and that's the omega-6 and omega-3s. And if we get too little omega-3s, so the body is forced to use other fatty acid composition, well, then this cell membrane will be hard and rigid. It means that only a few of the nutrients from what we are eating is getting into the cell. Only some of the waste products are getting out. The cell cannot produce as much energy as we want. Microcirculation is working much lesser than what we want, and thus also how we combat inflammations. But if we have a healthy cell membrane with a normal function, the way it was planned from the beginning, the cell membrane will be soft and pliable. It means that the nutrients from the food we're eating or the supplements we're taking are easily getting into the cell. The waste products are getting out. The cell can produce energy. Microcirculation is working the way we want it, and thus also how to combat inflammations. And ladies and gentlemen, brothers and sisters, the image I'm showing you here, this slide here, is basically the fundament that this beautiful house that we live in is standing on. This is really where the difference between good and poor health is occurring, and it is impacting all the 100 billion cells we have in our body. And just to explain to you, omega-6s and omega-3s are converted from the what we call the vegetative source. So for omega-3, it is supposed to be like this, that alpha-linoleic acid that we can get from seeds, some nuts, some berries and things, should then be transferred into what you see here, stearidonic acid, into EPA, DHA, and then DPA and DHA. But the same thing is happening on the omega-6 side, where linoleic acid is converted into D-homo-gamma-linoleic acid, and in the end into arachidonic acid. But the problem is, through this desaturase process and elongase process, is that it's always omega-6 that wins. So when it comes to converting this vegetable omega-3 fatty acids called alpha-linoleic acids, that conversion ratio is working very poorly for us human beings. Actually, less than 5% can convert less than 5% of the amounts. So it means that the omega-3 fatty acids that we call EPA, DPA, and DHA, where the sources are from the ocean, from seafood, it is essential to add through the diet, and I will explain more about why it is so important. It is controlling omega-6 and omega-3, an extremely important process in our bodies called the start and stop mechanism for inflammation. So put very in layman terms, I use the word standby, but in medical terms, it's normal homeostasis. Then we get some kind of outer influence. We get an insect bite. We cut ourselves in the finger when we are cooking in the kitchen. We get an allergen through our breathing system or through our mouth. Microbes, I mean, all of us have been talking about the viruses now for the last 2 years, but also bacteria, fungal growth, parasites, and so on are causing us to go into protection mode. And the protection mode that is so important is called acute inflammation. And that is actually a very good thing. It's necessary for surviving the attack. And Hippocrates, and a Roman doctor back 2,500 years ago, said that the thing that recognizes that the acute inflammation have started is redness, pain, swelling, and heat. And this is triggered by this omega-6 fatty acid called arachidonic acid. So this is, again, a very necessary for life thing. But if we now don't have enough stop mechanism, we are lacking the omega-3 fatty acid, particularly important here, called EPA, then this mechanism is not stopping. It goes into a chronic inflammation. And this is where we start the risk of developing all these lifestyle diseases that are taking far too many lives far too early. What we want, of course, is to have a good balance between arachidonic acid and the omega-3 fatty acid called EPA, so that this mechanism stops, it heals, it protects, it strengthens our immune system, the body gets rest and goes back to normal homeostasis or standby, and we are ready for a new attack. We don't know yet what the average test results will be in Africa, but we have already started, and Jackson said that we will offer some tests to some of you distinguished colleagues there. And what we do know for sure is that the average in Europe is 15 times more omega-6 than omega-3. So there is no wonder to explain why so many people end up in the low right-hand corner with chronic inflammation and the development of all these lifestyle diseases that takes far too many lives far too early. And if you look here at the health promoting properties of the eicosanoids, these signal molecules that are produced from the omega-3 fatty acid called EPA, eicosapentaenic acid, but you can see there some very important things. We talked about cardiovascular diseases being killer number one on the planet. This is contributing to normalize the blood pressure, to stimulate the immune system, to reduction the pain transfer, to reduction blood clotting, to lower triglyceride levels in the blood, which is extremely beneficial for people with diabetes. The same, of course, goes with the blood pressure, and then fighting inflammation. And this is why EPA is so important, and this is why it's so important to understand your patients, what kind of level are they on? And with this balance test that Jackson talked about a little earlier, and Dr. John as well, we have today done over 800,000 balance tests worldwide. And what we do when we prick the fingers, sting the finger, take out a few drops of blood, we are actually measuring 11 fatty acids that comprises 98% of all the fatty acids in your blood. And all the analyses are done at the big independent laboratory in Oslo, Norway. It's actually half an hour drive from where I live. Vita's Laboratory Analytical Services is a GMP certified laboratory. It is the most modern in Europe when it comes to dry blood spot testing and biomarkers. And you can see here a number of the universities that are using them and are official partners to them. All the tests are anonymous. So the only way we can find your test result or your patient's test result is through a unique barcode. And there we can go in and see the result based on these few drops of blood, the red blood cells that we are measuring. And based on that, we can then literally see which color it is on your or your patient's oil labs. So you can track your progress. We do a test number 1 to see where the patient is starting. We do a test number 2 after 120 days, because that's the time it takes to replace all the red blood cells. And based on the analysis, we can read out basically a lot of very, very interesting parameters or indicators, like the omega-6 to omega-3 balance. We can see your protection value against inflammation, what we call the fatty acid profile value. We can see your omega-3 index, the sum of EPA and DHA. We can see your mental strength index, and I will explain more about that as well. And you can see the fluidity index of your cell membranes, and of course, how efficient your body is converting the various omega-6 fatty acids into arachidonic acid. And here we can see on the app on the telephone here that this is an individual going from an unbalanced diet of 11 to 1, adding the balance oil that I'm going to explain more in detail, ending up after 120 days to 2.1 to 1. And so far, we see a world out of balance. The global average so far is 97% of those that we have tested have an imbalance of 3 to 1 or higher. And if you look in details, and these are statistics from Europe, we can say that only 5% of those that we have done a first test on has a natural balance of 3 to 1 based on their natural diet, so to speak. Then the yellow group there, that's some people tested that are using some kind of omega-3 supplement. I was part of that group when I started with the Zinzino products and the balance oil. But what we see here is that that group on 20%, they are not really getting into balance. The average there is at 7 to 1. Me, myself, I took a capsule that I bought at the pharmacy in Sweden, because I was working, my headquarters was in Sweden in those days when I worked with healthcare. And my average was 5.5 to 1. And that's after 4 capsules a day. The package said 1 to 2. I took 4 and I didn't get a better balance than 5.5 to 1. But then again, we can see in Europe, those that are not taking any supplements, they are on an average of 15 to 1. United States, 25 to 1. So what did Zinzino do to fix this problem? Well, they gathered a scientific advisory board headed up by Dr. Paul Clayton that I mentioned earlier. He's a pioneer in the study of phytonutrients, the effects of foods and how it impacts our brain and behavior. And he is a fantastic and incredibly knowledgeable person and a fellow at university, like I said, of Oxford. Ola Eide was the founder of Bioactive Foods, who actually developed the balance concept. And he has a number of leadership positions, chairman of the board of the Norwegian and Nordic food research programs. You can see that director of innovation at Mills and R&D director at Tea, the Norwegian Dairies products. Professor Dr. Angela Maria Rizzo from the University of Milan is really a truly expert in everything related to biochemistry of lipids. She was also a key player to help developing the balance test. And of course, our Dr. Anandharai Abraham, with over 40 years of experience in the health and nutrition industry. As you can see, qualified as a medical doctor in 1974 and has experience in both government, hospitals, and the various medical disciplines. And with these brightest minds in the field, we, through wellness and nutrition, they help us develop our test-based nutritional system, patented products, and we have our own manufacturing and R&D, which means that from ID to finished products goes very fast. So we can actually bring you back or your patients back into balance within 120 days with all the health benefit that's are included in that. And one of the reasons why we do that is not one reason, it's actually three important things that are unique with our test-based formula. Here you can see an image of our balance oil, our Zinzino Balance oil. And it is like this, ladies and gentlemen, that it is a requirement from governments globally that if you want to use wild fish oil as an omega-3 supplement, it is a requirement that this fish oil is purified. It needs to be completely clean, where all toxins, dioxins, all heavy metals are removed, like lead, mercury, so on and so forth. And when that process of purification is taking place, the fish's natural protection from going rancid is also removed. So one of the biggest responsibilities from a manufacturer of omega-3 supplements is actually to protect the fish oil, which is a very unstable oil and it's very easily going rancid or going oxidized. It's to protect it, not only in the capsule or in the bottle, but also in our bodies. So what we are using that is unique in Zinzino, we are actually using extra virgin olive oil. So 40% of the content in that bottle that you see on the picture is actually extra virgin cold pressed olive oil from olives that are pre-harvested. They are harvested a few weeks before they are ripe, because that's when the level of antioxidants or polyphenols, as you may be aware of or familiar with, are at this utmost highest level. And the polyphenols that we are using in our extra virgin olive oil, they are called something so nice as hydroxytyrosol. They are actually 17 times more powerful than vitamin C, that we know is the most powerful of all vitamins when it comes to the antioxidation protection capabilities. And this has shown historically to be extremely well to protect wild fish oil from going rancid. And then the third parameter, which is dosage by weight. Many manufacturers of supplements, omega-3 supplements, they say 1 to 2 capsules per day from 5 years and upwards. And all of you, ladies and gentlemen, that are sitting there listening to this presentation, we all, of course, know that a little girl, 5 years old, weighing 18 kilos, does not need as much as I do, being 88 kilograms and a gentleman on 59 years. So these three things, high quality, purified omega-3, very rich on EPA, DHA, and DPA, protected by extra virgin olive oil, and then dosage by weight, these three things together will give powerful synergistic effects for your health. And we are thus helping 95% of those that have been using our products are getting into balance or near 3-to-1 in a period of 120 days. Then we add a little bit extra of vitamin D3. And I'm sure all of you throughout this COVID-19 pandemic have again we have been taught and underlined the importance of vitamin D3 to build a well-functioning immune system. And most of us do not get enough sun exposure to produce what we need, particularly not for the Nordic winters. Then we add a little bit extra vitamin E. And then I want you to know that this is an all natural product. There are no artificial ingredients. It's all original, and there is no risk of oxidation, because we all should know that to eat a supplement that is going rancid in our bodies is actually worse than not taking the supplement in the first place. So very important. And then, you know, when I do a presentation, I often ask, okay, so how many times per week do you eat fish? And we know that it's hard to get healthy, fatty fish. But this table here shows you that 1 day dose for an 80-kilogram individual of 12 milliliters of balance oil, that corresponds to these various types of fish or seafood that you can see there. And okay, I like fish balls, but 9.8 kilograms per day, 365 days per year, I'm sure you agree with me, it's a little bit too much. And the same goes for all kinds of white fishes, because they are not very fat. The fat in the cod, for instance, it lies in the liver. So you need to get to fish types like salmon, herring, or mackerel to get doses that are manageable in order to get the same effects of EPA, DPA, and DHA that you get from a 12 milliliter daily dose of balance oil. But the good news, ladies and gentlemen, is that a daily dose of balance oil, 12 milliliters, is cheaper than any of the alternatives of getting the fish. And with the balance oil, you get something that is pure, no mercury, no lead, no poisonous ingredients, because unfortunately we have treated our ocean as a big garbage can over the last 200-300 years, with the negative impact we see today with microplastics, mercury, lead, and so on and so forth. So we are very proud to be able to say that our product is made with the highest quality and care. Our producer of fish oil, wild fish oil, is a company up on Reykjavik in Iceland. It's the largest producer of omega-3 fish oils in the world. It's called Lysi Factories, and they are GMP certified. They have the certification of Friend of the Sea, which means that all of the fish is utilized in a good way. The catch, the producing of the fish oil is done in a very humane way. Informed choice means that there are no conflicts with doping for top athletes within our products. ISO 9000 certification, and of course, everything is non-GMO, sugar-free, soy-free, gluten-free, keto-friendly. So you can be sure that if you use this yourself or you recommend any other to use it, they get the best they possibly can get. And we are extremely proud of being able to tell you that 95% of those that have taken the Zinzino Balance product have reached a ratio of near 3:1 after 120 days. And I'm going to go through with you these 18 health claims that are approved by the European Food Safety Authorities. And what EFSA is approving is that when a certain supplement is containing a certain number of ingredients, you can make these claims. And one of the first ones is for the brain, normal brain function. And let me just underline to you that 60% of the dry weight of your brain is fats, whereof 40% saturated fat, 20% omega-3 fats, where the omega-3 fatty acid called DHA is by far the most important, but EPA, DPA is playing a very essential role in reducing the risk for inflammation in our brain. And this study here, done at the University of Siena in Italy, looks into the changes in wellness indicators, your mental health. And what they looked at is, if you go from an imbalance of 9:1 or higher, getting down to 5:1 or lower, it has a very positive impact on anger, anxiety, fatigue, depression, confusion, and energy. And the latter one, energy, is something that a lot of people are experiencing once they start getting their omega-3 levels up, that the energy level is one of the first things they experience. And of course, the reason being, like I talked to you about or mentioned earlier, about the cell membrane, the uptake of nutrition, when the cell membrane is well functioning and it being the way it is. So we actually can take more up of the nutrients from the food we're eating. And then when we look at the rest here, heart function, bear in mind that the most important lubricant for your cardiovascular system is the omega-3 fatty acid called EPA, where actually most people are lowest, unfortunately. Then for normalizing your immune function, our retina is built up of omega-3 fatty acids, so it's very important for a normal vision, the teeth, the normal brain development of the fetus and breastfed infants, and I will talk more about that. Normal bone structure, fighting oxidative stress, normalization of blood pressure, like we talked about earlier as well. Not only blood pressure, but heart rhythm and also arrhythmia, very important. Cell division, normal blood triglyceride levels, I mentioned that earlier as well, and so important for people with diabetes. Then the normal development of eye of the fetus and breastfed infants, protect cells against oxidative stress, normal absorption of calcium and phosphorus, normal blood calcium levels, normal muscle function. Well, you can see that there is nothing here that is not important for us, so that this fantastic machinery we have is working the way it was expected to be. In other words, having a good and long life without all the problems that people are experiencing when they get older, which is not necessarily thing to happen. Lower or reduced blood cholesterol, and of course, visual development of infants up to 12 months of age. Let me spend a few minutes on pregnancy and breastfeeding, because in this book here, written by the medical doctor Ulla Haglund, it's a very, very interesting book, unfortunately not translated into English yet, but in this omega-3 revolution, he says that our knowledge of how the fetus brain develops during pregnancy and how the baby's brain develops during the breastfeeding period has increased dramatically. And then he says, given the complexity of the brain, I'm not surprised that some children suffer from dyslexia, ADHD, ADD, dyspraxia, and autism, or adults suffering from depression, schizophrenia, Parkinson's, dementia, Alzheimer's, etc., etc. He is actually surprised that there are so many people without these neurological disorders sorry, I repeat there. And I'm sure you are experiencing that in your practice as well. But also what's important is that studies show that men's sperm quality in regards to number, mobility, size, and shape are strongly influenced by the levels of omega-3s, EPA and DHA, and the low-quality sperm in men can benefit greatly from omega-3 supplements. And there are studies now in Scandinavia showing that male aged 18 to 30 years, as much as 20%, I underline 20% of males have a sperm quality not good enough to make their woman pregnant, which is a frightening number, I think. And also to understand the fetus development. In the 10th week, every single minute, approximately 200,000 new brain cells, neurons, are created every single minute. And nature is securing the fetus and the newborn's great need for polyunsaturated fatty acids, particularly omega-3 fatty acids. And the way it's doing this is to take from the mother. Right? And the way the woman's brain is affected through this pregnancy, unless the mother is adding supplements throughout the 9 months, that pregnancy causes lasting changes in a woman's brain. And leading English researchers have shown that the brain decreases by about 5% in the last 3rd month. An increase in the volume of the brain cavity occurs as well, and the brain decreases in size during pregnancy and increases in size and recovers the fatty acid content after delivery in about 6 months. And this is what you can see, the researchers' leading hypothesis is that the mother releases important polyunsaturated fatty acids from her brain cells, and this is then transferred across the placenta to the developing fetus. And what's interesting to see there is that the women's brain is affected in a way because of the lack of essential fatty acids in the mother after childbirth could explain the commonly occurring fatigue, sadness, depression, and what we call the breastfeeding fog. And during the last months of pregnancy, the number of brain cells increases highly to about 100 billion cells at birth. And this requires great access to the omega-3 fatty acid, particularly the one I mentioned earlier, DHA, which is significantly the most important fatty acid in the brain. And supplementation of omega-3 fatty acids is very important during pregnancy and breastfeeding. And it's something we need forever in many different areas. Omega-3 fatty acids are fundamental for the human life and health. And it is no coincidence that the mother, through breastfeeding, transmits her reserves of DHA to the breast milk for the baby. And it's requiring a refill all the time. Women who have given birth usually have very low levels of omega-3 in their blood. And the only way to raise these levels is through food, nutrition, and supplementation. And in this book, you can see here, written by two professors in Germany called Omega-3 Active, they are actually warning that women are at greater risk of cardiovascular disease with worse outcomes compared to men due to the following two very important things. Number one, they do not receive the same clear warning signals as men with chest pain, back pain, etc. And after giving birth, they have even lower levels of omega-3 in the blood compared to men. No wonder, because they are carrying the fetus, although they generally eat the same diet. So to fill up here, extremely important. And let me also talk a little bit more about cardiovascular diseases, because more people die from CVD than from any other disease on the planet. And sudden heart death is a phenomenon where studies are showing that if you have an omega-3 index, a sum of EPA and DHA below 4%, there is a 10-time higher risk for sudden cardiac death compared with being above 8%. And this study was done by Harris WS, the omega-3 index as a risk factor for coronary heart disease. And in US alone, United States of America, of course, they are big on everything, but about 325,000 people die of sudden cardiac death each year. And let's now have a look how the balance oil can help stopping and even reversing a negative development of atherosclerosis. We all know that our arteries, they are highways for transportation of red and white blood cells, platelets, cholesterol, nutrients, and so on and so forth. And people that are eating a diet with too much sugars, too much refined carbohydrates, on the transport to and from the cells and from the cells back to the liver to be metabolized as fats, it's causing injuries, small wounds on the inside of the vessel wall. And these small wounds, because remember the speed of the pulse wave is somewhere between 7, 8, 9, 10 meters per second. So with the sugar being transported to and from the liver, it's actually like sandpaper on the inside of the vessel walls. And these small wounds are triggering inflammations. And that's where our LDL cholesterol comes there to penetrate the vessel wall, to accumulate. And what happens, it's trying to repair it, but it actually oxidizes. It triggers an inflammatory response, but as a good thing. So it's the sugar that is actually causing this together with the refined carbohydrates. What then happens is our macrophages, our cleaning cells, the big eaters, are coming there to help. And that's when the problem starts, because the macrophages are turned into foam cells, or what they say in medical terms, atheroma, which gives more and more unstable plaque. And of course, we all know that when this plaque is there, so this 3-lane motorway, because of, let's call it roadworks, is now narrowed into only 1 lane, then of course the brain gives a signal and tells the heart, hey, you need to pump faster, so the heart rhythm goes up. You need to put in more power, so the blood pressure goes up, and often it's combined with arrhythmia as well. And what we don't want to happen, of course, is that the plaque ruptures, a blood clot is coming out, leading to a heart attack or a stroke or pulmonary embolism. But now comes the good news with the effects of the polyphenols from the balance oil, these very powerful antioxidants in the extra virgin olive oil mixed with the omega-3s in our balance oil. Because what we know, and these are health claims that are approved by European food safety authorities, the polyphenols from olive oil can prevent oxidation of plaques and reduce oxidative stress that causes inflammation and influx of macrophages. And what we see over time is that this will stop the formation and the development of atherosclerosis, and not only stop it, but also reversing it, because it is preventing inflammation. And together with the omega-3 mechanism that changes the properties of the cell membranes that we talked about earlier, it affects the eicosanoids and the inflammatory response, resulting in reduced arterial plaque vulnerability, normalization of blood pressure, heart rhythm, arrhythmia, and giving improvement in endothelial blood vessel wall function, and of course, reducing what we call the bad cholesterol, the LDL, the low density lipoprotein, because inflammation is reduced. And this is actually using the body's self-healing mechanism by adding the right ingredients to help this to be a powerful effect for our health. And you all know that atherosclerosis, actually we start the predisposition or negative development of atherosclerosis already at 10 years of age. So when somebody get a heart attack when they are 54, 58, 65, whatever it might be, it's not because of something that occurred overnight. It's not because they were celebrating their friend's birthday too tough. It's a sum of what we have been putting through our diet, through our mouth, and sugars and refined carbohydrates are causing the most damage. And that's the same thing also that is causing into diabetes too, and a thing that we never had in our diet if we go back to the Stone Age. So what we have seen now very quickly in this presentation, and I hope you heard me loud and clear, but there are health benefits of being in balance from before, during, and after pregnancy, in the growth of the newborn child, up in the adolescence, up as an adult. It is so important, and all our cells, they need this so they can all dance after the same nice melody until what our biological clock is made to be going to 120 years with a healthy brain, healthy immune system, healthy heart, with joints and muscles that are not causing us stiffness or pain, with a healthy metabolic aging, and our bones that are there to be able to carry us without osteoporosis and all kinds of other problems that may occur. So being healthy, staying fit is a good thing for us. And in Zinzino, we have as a mission statement to inspire change in life for our customers, to help them understanding what they can do to put out the fires and how to add the balance oil so that it can be out there working and helping all the 100 billion cells we have to do the right things for us, combating inflammation and living a good life, long life, without all the problems of old age. So with that, I would like to thank you so much for listening to this. And I don't know if we want to open up for some questions there.